Good morning, everyone. Thank you so much for joining us on our webinar today. So the topic is nootropics and cognitive function, and it's going to be presented, as you can see, by the lovely Dr. Paul Erkel. My name is Dr. Navneet Nibber. I'm a medical advisor with AOR, and I'm going to be the host and moderator for today's presentation. Before we get started, I just want to go through a few housekeeping items so this runs nice and smoothly for everyone. There is a question and answer session at the end of the presentation. So we really encourage you all to ask presentations. And if you want to access that, there should be a little question box control panel to the right of your screen. You can just ask throughout the presentation. If it doesn't get answered right away, do not worry, we'll get to it at the end. And please do note that this presentation is being recorded for future distribution. So the content of the webinar really has not been evaluated by Health Canada or the FDA, and is really meant to be educational in nature. So we don't want anyone to be taking this as specific medical advice, and we should always be consulting a qualified medical practitioner to see if the diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease, and the opinions of the guests, hosts, myself, do not necessarily reflect those of advanced orthomolecular research. So now that that's out of the way, let's meet our presenter. Dr. Paul Erkel is a board-certified naturopathic doctor practicing in Toronto, Ontario. Dr. Erkel, and I'm lucky to have worked with him for so many years, is so well-versed on neurological health, so this is a really lucky kind of presentation to be able to see. He focuses a lot on chronic pain, brain injuries, and is very heavily involved in teaching, education. He's always writing and lecturing to both healthcare practitioners as well as the public. He is our medical director at Advanced Orthomolecular Research, and the chief mandate he has really been sharing is that we really want to promote the science supporting these natural medicines and formulate really effective natural health products. So we are ready to begin. So without further ado, I will turn it over to Dr. Erkel. Welcome, and thank you so much.
Thank you so much, Dr. Nibber. That was a great intro, and obviously a great pleasure to be here with everybody. I'm really going to have a lot of fun with this presentation, actually. When I was putting it together, and I've presented on this topic of nootropics before, but never as just this being the main topic. In many times in presentations, whether it's in concussions or brain injuries or stress or optimizing health or the gut-brain axis, I've touched on many of the things we'll talk about. But I had a lot of fun putting this together, and so hopefully you'll have a lot of fun learning about this as we go through this presentation. We have quite a bit of material to get through, so I'm going to really kind of blast through it in some cases and then really slow down and focus on some areas that I think are going to be very important when it comes to optimizing brain health. After we get through these kind of typical disclaimers that we have before all of our webinars, obviously don't take any of this as medical advice, as Dr. Nibber mentioned. One of the things that, as I was putting this presentation together, was very evident, and I share this a lot with my patients and any colleagues that I lecture to, is that when you look at supplementing to support the brain, which is in essence what nootropics are, it's very tempting to be focused in on, okay, you know what, this one thing does this, and if I take this, my brain will be better. And one thing that my patients have taught me for the last decade, since I started practicing as a naturopathic doctor, is that oftentimes that's not the case. And so I started this presentation really focusing on making sure we understand the foundations. And so that's kind of where we're going to start off in the first part. And then we're going to talk a little bit about the stress-brain connection. And then we're going to focus on some specific nutrients, and especially herbals that have been studied to support brain function. I'm going to share with you what the research shows. I'm going to share with you what my clinical experience has shown as well. So I'm excited, so let's get going. So we have to understand, what are nootropics? I mean, I think people have heard of this term before. Maybe some of you haven't. You've definitely heard of some of the nutrients and herbs that we are going to be talking about. Nootropics is a substance, any substance that enhances cognition, memory, and facilitates learning. And so when you look at this definition, you can actually apply this to almost anything that has anything to do with the brain. So anything from, for example, we'll look at some B vitamins today. Well, they wouldn't be considered kind of a really advanced or cutting edge nootropic. They definitely have some nootropic properties, some amino acids, which we'll talk about, and then obviously some herbals. And so I think a good place for us to start is just to kind of look at the lay of the land of what has brought about why nootropics have really probably in the last 5 to 10 years become so popular. And I think in things like Time Magazine and other publications and media, the last frontier is the brain. And that's something that has been termed as such because that is an area and an organ that we are still really trying to wrap our heads around, pun intended. And many other systems like the cardiovascular system and the pulmonary system has been explored in detail in previous decades, but the brain is still something that we're really trying to uncover. And so anything that's going to help support brain function, and in fact now there's so many things that are conspiring that to decrease brain function. I'll give you a couple examples. Put this into perspective, is that a lot of my patients, especially ones that have had a brain injury like a concussion in the past, or that are just dealing with, let's say something like hormones or pain, they've noticed that their concentration and brain function and focus has been impacted just during this period of time where they're now socially and physically isolated. And so you can see that there are many things in our lives that are now trying to compete for our mental faculties. So there's a huge need for substances that are not harmful, that are natural, that are going to be supporting, cognition, memory, and learning in a very effective way. So that's part of the context of where we're coming from with this. But I think people have been looking at this for a long time. Scientists have, and there's this really kind of subculture of anti-aging and this term called neurohacking. If some of you have heard of that before, it'll be familiar to people that have been looking, okay, you know what, I'm looking to, get more production out of my day. I'm looking to be able to sleep less and do more. And so this is a big trend that's happening. And there's a dark side to this trend as well. It's important that we want to have optimal brain function, but there's also a negative drawback. So there's this idea that substances can create these brain effects. And we've known about these types of substances for a long time. And so I listed a couple medications. So these are prescription medications, all except for the last ones on the list here. You can see Piracetam, Nucept. Basically, these are orphan drugs. So they used to be medications, which is why I included them here. But things like Mondafil, amphetamines, methylphenidate, so like Ritalin, Concerta, we've all heard of these substances before. They're actually pretty commonplace. They're being used for primarily ADHD is the most common diagnosis, but even that diagnosis has substantially gone up. The diagnosis of ADHD was nowhere near as prevalent now. And so is that because people are genuinely have ADHD, or we just have been misdiagnosing it? And then now people are, maybe we call it on the ADHD spectrum. So they might have some issues with memory and attention, and they might have some issues with school as in their childhood. And then they're prescribed these medications. And now they are using these medications even in university. And so there definitely is a side to these medications that are being over and above the pathological diagnoses like what I listed there. So are smart drugs really that smart? And I kind of dove into the research just to understand this. And, when I went to school, almost 15, 20 years ago, there were rumblings of people using caffeine pills and different medications, but it really was nowhere near commonplace. It was actually the exception. But now research is showing up to 30% of students in colleges and universities are using some sort of non-medical, so meaning that they don't have a diagnosis like narcolepsy or ADHD, and they're using the medications used for these conditions. They're stimulants, and they're using them to try to improve their school function and their school results. And so what was really astounding to me is when you looked at the research, it was pretty clear to me that while there was improvements in things like focus, especially late at night, trying to do cram sessions, but they found that the students actually didn't do any better. Their results, their GPA was the same. And so you start wondering, is that really worth taking these medications? And what are some of the downsides to these medications? Are there side effects? And there definitely are. Especially, this class of medication generally are CNS, so central nervous system stimulants. They're stimulating the nervous system. And whenever you stimulate something, I mean, we in the natural world have used stimulants like caffeine from cacao and cafe arabica, which is coffee, for millennia. But now when you start concentrating these things down, that's what illicit drugs are, is that they've originally come from a natural substance and they've been concentrated down. So there are some side effects. And so, for example, this class of medications, stimulants specifically, have sleep deprivation, anxiety, hallucination, depression, high blood pressure, and interestingly enough, an increased risk for use of alcohol and illicit drugs. So there are downsides. So I think that's a good segue into, is there anything in the natural world, in the plant world, that we can use to support brain function, but maybe doesn't have some of the negative effects? And these are some of the common nootropics that are in the natural world: caffeine, ginkgo, ginseng, maybe creatine, which really isn't a nootropic, but it kind of gets thrown in there. And so there's a wide range of substances. This is a very limited list. And I included these orphan drugs, so-called orphan drugs: piracetam, phenotroprazole, pill, and Nucept, which is, again, these synthetic molecules that originally were being studied as drugs, but they since have been abandoned and not used from a prescription perspective anymore. So what is the deal with these substances? Can they be helpful? So let's dive into that. Let's understand it. So before we get into each of the individual substances, I really wanted to just take a real big bird's eye view and a step back to be like, okay, let's not get lost in the weeds here, and let's appreciate the forest and not just the specific trees. This is a nerve that you can see here clearly, and all the different anatomical pieces of the nerve, all the different chemical structures of the nerve. Let's just highlight 3 of them that are going to be really relevant when it comes to promoting nerve functions. Remember, our brain is a mass of these neurons or nerves, and the communication between the nerves is what generates our thoughts, feelings, processes, etc. Any sort of neurological and musculoskeletal function. And so there are certain things within these nerves, like, for example, the mitochondria, which you can see right here. They are the power plant of our cells. So if we have more fuel, the nerve cells will function better. We know that very well. Also, the way that the anatomy of the nerve works is that there's fat surrounding the nerves. You don't see it very clearly here on this diagram, but there's a myelin sheath. So there's fat surrounding these nerves, and that fat allows the transmission of nerves to happen properly. A case like, a pathology like multiple sclerosis is actually a demyelination, meaning that there isn't fat around these nerves anymore. There's an autoimmune reaction to it. And so now the transmission is disrupted. And so when you think about it in the positive, if we can optimize fat and we can optimize the transmission, we're going to have faster functioning and better functioning. And then finally, the communication with other nerves. So nerves are not in isolation. They're communicating with each other, and they do this with these synaptic terminals. So basically these kind of like endpoints, and this is where neurotransmitters are produced. This is where neurotransmitters are stored in these little tentacles here, you can see. And this is what is constantly being released and then reuptake, and then released and taken back up. And there are enzymes that do this, and there are vesicles that secrete them. And so it's important to understand that it's not just about how do we do one of these things. We have to appreciate the full function of the nerve. And so I think it's the context, especially if we look at the last arrow that I just showed here. the context is if we want more neurotransmitters, and each neurotransmitter has its unique function, as I'm going to share with you here, we have to also appreciate there is a biochemical pathway to produce those neurotransmitters. And so in the case of serotonin, which is typically our kind of happy hormone, if I was going to summarize its effects, it does many other things, like gut function is one of them, for example. But the feeling of happiness, the feeling of satisfaction, that's serotonin. And it actually is a precursor for melatonin, which is obviously our master circadian hormone, as well as being a master antioxidant and many other kind of protective effects in the body. You can see here in purple, look at all the cofactors: folate, zinc, magnesium, vitamin C, B6 in the active pyridoxine 5-phosphate form, B5. If you're deficient in any one of these things, you can supplement with all the tryptophan you want, or 5-HTP. You are not going to produce serotonin as well. If you're deficient in B3, this is something that the pioneers in orthomolecular medicine have known for a long time, using high doses of B3 to address schizophrenia. Dr. Abram Hoffer was the pioneer in this. And this is exactly why having optimal levels of B3 is going to allow serotonin to be properly produced. If you're deficient, the body's going to want to make sure you has enough B3, so it's going to shunt all tryptophan down that pathway. And you can apply the same concept to dopamine. So again, the precursor from tyrosine to L-dopa to norepinephrine. Iron, B6, magnesium, vitamin C. You're going to see a reoccurring pattern here. A lot of these key neurotransmitters, GABA is another one. It's a very common inhibitory neurotransmitter, where dopamine is a little bit more of a willpower stimulatory, motivational neurotransmitter as kind of a general function. Has B6, GABA has B6 as one of its key cofactors, as well as having optimal glutamine levels. And then finally, acetylcholine, which is responsible for memory, which sometimes is a focus for nootropic and neurohacker aficionados. B1, B2, B3, B5, and the fat choline, having enough of those is going to be absolutely essential to produce adequate levels of acetylcholine, which is the neurotransmitter. So I wanted to give everybody a snapshot that while, yes, we are going to talk about specific herbs and they're going to influence some of these neural pathways, you also have to make sure that you have optimal levels of all the cofactors. And most people that are walking around every single day do not have optimal levels. And there are so many reasons why that's the case, and we'll explore some of them as we go. Okay, so don't forget the foundation. So I mentioned nutrient deficiencies. That's one of them. You can see them here. So that's why I've bolded it, because I am touching on it. But don't forget things like sleep. And I've tried to order it, what I think is important, but it's in no particular order per se. Sleep. When you sleep, you detoxify the brain. That's been researched in the last decade, which is actually quite new. There's a lymphatic system in the brain, and those neurofibrillary tangles, like, for example, tau protein and beta amyloid, the stuff that pathologists have identified as the main issue when it comes to Alzheimer's and Parkinson's and a lot of these neurodegenerative conditions. Sleep is important for eliminating those tangles out of the brain. Important for growth hormone production, a lot of kind of the neural healing. Also important for memories. A tidbit here from a clinical pro perspective is that people, especially students, are trying to cram in for their exams, and they're not respecting physiology when they do this, because when you're trying to accomplish something that requires memory and recall, most of your memory and recall occurs during REM sleep, or the rapid eye movement sleep. And this happens periodically through the night, especially more towards the morning. And this sleep is really important for processing and storing those memories for them to be accessed at a later time, like during a test. So if you're trying to cram for something and stay up late, your brain is not going to retain those memories. So it's probably better to go and get some sleep and then wake up in the morning to be able to actually recall some of the memories that you do have. Hormones, we won't talk about it, but needless to say, they have a powerful effect on the brain. Anybody that's gone through menopause knows hormones play a huge role on the brain. Brain fog, mommy brain. You've all heard of these terms in kind of mainstream and social circles. And this is definitely the case where estrogen, progesterone imbalances, testosterone levels all can impact brain function. Something as simple as testosterone in my male patients. We know that after a person has sustained a car accident, a brain injury especially, they're at risk for deficiencies in hormones. And one of the major signs that I see with my patients is that they become depressed, and the depression usually comes on probably months, sometimes even up to a year after they've had the injury. And that's because there's a steady decrease in their hormones like growth hormone and testosterone. And so that's such an important consideration to respect when we're looking at, oh, you know what, a person might have low mood. Could there be hormones as the issue? We're going to talk about stress, so we won't talk about it now. Inflammation is a huge thing. It's as an underlying issue for any sort of injury that happened to the brain, but also low-grade inflammation from an autoimmune perspective has a huge issue with brain function. So things like brain fog, other autoimmune conditions like Hashimoto's thyroiditis, hypothyroidism in general has been linked to brain deficiencies and memory processing, etc. We're going to talk a little bit about the gut. We're going to talk about the concept of hyperpermeability, and then finally diet. Alcohol is a huge one. Pro-inflammatories are huge ones. Sometimes people are eating things like gluten, which has a big connection to the brain, and they could be getting an inflammatory reaction happening in the brain. And the issue is actually avoiding the food that is the offending substance. So you can see just by me spending almost 5 minutes on this one slide, there's so much to talk about in making sure we get the foundations right. But unfortunately, we have to move on. I'd love to spend more time on that, but I want to make sure we get to the substances that you want to learn about boosting brain function. So things to remember, you can refer back to in the slides that I shared in the PDF document, refer to this at your own leisure. Vitamin D, magnesium, vitamin E, zinc, and the B family vitamins, and I would include iron if you're iron deficient. These are the core things that your brain needs to function. If you notice, one of the things that is the first point in each one of the rationales section here is that large percentage of the population is deficient. So, a large percentage might be something like 30% of people are deficient in vitamin D. That's a pretty large percentage. And it gets worse in Canada because we're exposed less to natural sunlight. Magnesium, large percentage of people are deficient. 50% of people, 90% of athletes. Vitamin E is one of the most overlooked and underappreciated vitamins. And it's the one that's been actually most studied when it comes to brain health because it is the fat soluble vitamin. And it, again, brain being primarily fat, over 60% of it being fat, vitamin E plays an important part in protecting the fatty tissue and brain cells. So vitamin E is not to be overlooked, which unfortunately often is. Zinc, B vitamins, both important for the production of neurotransmitters. The first formula that I wanted to share with you is not one that you think about in a nootropic lecture or a nootropic webinar, but it is one that is absolutely imperative from a foundational perspective. And the reason I chose Advanced B Complex Ultra is that the Ultra formulation has the additional brain support. So it's all the beneficial active forms you're going to find in the ABC, the regular Advanced B Complex Ultra, plus it has the addition of biologically active B12s, which I'll show you in a second, an antioxidant called PQQ, which is part of the B vitamin family, but it has research showing it improves memory just in its own right. And so AOR does have a formula called CogniQ, which patients have told me that, their brain function just improves by taking that. And a lot of that has to do with its ability to support the mitochondria, which again, back to my original foundation slide, is producing enough energy for the neuron is essential for its optimal function. Remember that in conditions like a brain injury, like a concussion, for example, that's a really good example of where the mitochondria actually become damaged. They don't produce enough ATP. And so an antioxidant substance like PQQ and B vitamins are really important at protecting that mitochondria and restarting it. It is a smart tablet. I do like to mention that it is a slow release tablet, so it's able to be time release, just like it says in the bottle. And this is great for people that have that later in the afternoon lull. And so one of the big differences over and above the ingredients between ABC and ABC Ultra is that you're going to have this longer release and you're going to have that longer beneficial effect of the Advanced B complex. And so you have the dissolution of the B12 and B2, all the stuff that needs to be mixed with gastric acid, and then the niacin, which is going to be flushing you, is kind of impregnated in kind of a matrix that is slowly released, so you don't get that flush. So overall, B complex ultra is superior in almost every single way compared to the regular ABC. And so you can see here in red is some of the differences. You can see the PQQ here, and you can see the addition of the cell-butymine and other forms of B12. And so these are the three forms of B12, hydroxy, adenosine, and methyl. And the ultra contains the addition of the adenosine as well as the hydroxy form of B12. And so now you're getting the full spectrum, where methyl is typically going to do methylation, which is important, but also the adenosine form is going to be protective more for the nerve lining, so the myelin, as well as mitochondrial function. And so here's that research study I was talking about with PQQ showing improvements in memory. And so this can combine with CoQ10. And so there's a lot of synergy, like with vitamin E and vitamin C, which I showed you in that chart. PQQ and CoQ10 do work hand in hand, and there is a formula called CogniQ that AOR has that has a higher dose of CoQ10, 300 milligrams, and 10 milligrams of PQQ. So if you're looking to get high amounts of PQQ, that's the substance, one a day, that you need. Okay, so that is kind of the foundational nutrient things. Now we're going to look at the gut functions. And we've heard of the gut-brain axis. You maybe heard me talk about it before, but just wanted to quickly just highlight very, very briefly the important things as it relates to the gut. And I mentioned things like nutrients absorption. So if you're not getting proper absorption, if there's inflammation, you can see if there's leakiness and inflammation, like here, you're getting toxic substances and food proteins let in. That causes inflammation in the brain as well. That causes cross-reactivity with certain brain tissues, impacts the blood-brain barrier, which you can see here. That's been well researched now, showing that a leaky gut equals a leaky brain. And you're going to have this system-wide detrimental effect. So healing the lining of the gut with things like probiotics, fiber, glutamine, zinc, these are substances that have been shown to improve the permeability of the gut lining. You're indirectly going to be improving and boosting the brain. So you could argue that glutamine and zinc are nootropic ingredients for people that have compromised gut function. And so when it comes to the actual nervous connection between the brain and the gut, so over and above the actual lining, the gut lining has an incredibly important role to play. 80% of the substances or the connections, I should say, are pointing up to the brain rather than from the brain to the gut. So there's much more communication going up than down. And it's important to understand just from a context of a couple things. So first and foremost, I mentioned neurotransmitters. Look here, you can see that bacteria in our gut, our microbiome, produce neurotransmitters. So GABA, 5-HT, which stands for serotonin, is produced in the gut. And it also is produced itself in neuroendocrine cells in the gut lining called enteroendocrine cells or enterochromaffin cells. They produce serotonin, and you've probably heard that 80+% of serotonin is produced in the gut or by gut bacteria. And so again, this is to reinforce the fact that the function of our gut plays an incredibly important role when it comes to function of our brain. How do we support that? Here are a couple options that are evidence-based, but diaphragmatic breathing, deep breathing, prayer, mindfulness meditation. Think of just how many apps there are on meditation. There's technologies out on supporting mindfulness, but this has been going on for centuries, since the dawn of the human race, that we've been looking to quiet ourselves, and this is part of supporting the anti-inflammatory and brain supportive effect of gut. And so there's many other things like acupuncture, laughter, meditation, gargling. These are all things that have been shown to support the vagus nerve, which has that powerful connection between the brain and the gut. What about the stress-brain connection? And bear with me, because I know that a lot of you really want to get to some of the substances, and we will. However, it's important to understand all this will make sense in the context of what we're going to be talking about, especially this section here when it comes to cortisol. I've presented on cortisol for the last decade, and this is a graphic I've used for many years. And so this is cortisol when it's being produced in excess. Typically, you can see, it has the effects of increasing blood sugar via the liver. Why is that important? Well, cortisol is secreted when we're under more stress. Stress wants to keep us alive. So more carbs and fats, more fuel. But the downside is that it's going to also shut off things that are not important. Yep, that includes memory. And so memory, reproduction, bone formation, regulation of the immune system, these are all kind of secondary or maybe non-survival essential functions in the body. And there is research showing that if you have high amounts of cortisol, it's going to negatively influence your memory. And that actually has been fleshed out in lots of research studies. This is a 2018 study in the prestigious Journal of Neurology, and they were looking at that big, huge Framingham heart study, where they looked at thousands of people, originally for cardiovascular function, but then as they were dissecting all the data they collected, they found a correlation between higher levels of cortisol and then also cognitive changes and also brain structural changes. So you can see here in this brain, I guess their brain scans, that you can see that these areas, the blue areas, are areas that have been impacted detrimentally with excess amounts of cortisol. And if anybody that has a background in anatomy will notice that these particular areas, kind of in the middle, this is the memory storing areas, primarily the hippocampus. And this is the area that's going to store memories, very rich in acetylcholine, and that's the one that's really going to be detrimentally affected. And so you're going to notice that as stress goes up, you're not going to be remembering things as well. And this is something you maybe, if anybody's gone through a stressful event, that they've noticed themselves. And so from the study, higher serum cortisol was associated with lower brain volumes and impaired memory in normal, healthy, middle-aged, and younger adults. And the association, unfortunately for women, was stronger in the female sex. So women seem to have this excess predisposition, and that might be one of the reasons that women are more predisposed to Alzheimer's disease. We're still trying to understand that, but that may be one of the connections. And so just to understand, the stages of stress are, normally the body wants to deal with it, but if it continues, we don't rest, we try to resist it, the body tries to adapt, and ultimately it can fail. And so you've probably heard this as maybe the 3 stages of adrenal fatigue. I don't love that description, but I definitely look at the dysregulation of the brain, hypothalamus, pituitary, adrenal axis. And this is basically what it describes in a very simplified version. And so you can just quickly take a look. This is a normal cortisol curve throughout the day. But when you look at it under resistance stress, you can see, well, oh, look at the big spike in cortisol. Well, now I'm waking up at night. Now my cortisol, which is my get up and go hormone, is low in the morning. Now I have difficulty waking. I get a mid-afternoon crash because I'm now trying to fuel myself with sugary treats throughout the day to kind of prop up my energy levels. And then I might get a late wind at night, so I can't fall asleep. Plus I'm wakey at night. You can see this kind of disruption of excess cortisol, and a lot of this impacts the brain. I'm getting foggy. I'm so tired during the day. I can't sleep at night. Anybody that has had issues sleeping knows that their brain function is affected. So that's why I'm mentioning cortisol as one of the major influencers when it comes to brain function. And when we start looking at the tools that we have in the natural world, a lot of these so-called natural nootropics are adaptogens. And for most of you, I'm sure you've all heard of adaptogens. They're the family of herbs that helps deal with a stressful event in our bodies and helps our stress response. So normally it could be really exaggerated, and adaptogens help normalize that exaggerated response, as you can see here in this diagram. And conversely, you're going to have a decrease in the kind of detrimental drawbacks after a very strong stress response. So it's all about balancing the body's ability and supporting the body's ability to deal with stressors. So let's get into some of these particular botanicals, in no particular order per se, but one of my favorites is ashwagandha or withania. We've all heard of it before, especially when it comes to stress. It helps with chronic stress. It's been used traditionally for debility. It's been used traditionally for elderly and aging. And typically it's used for people that have this kind of wired and tired perspective, or they have this wired and tired presentation. And because ashwagandha has been studied to have an anti-anxiety effect as well as an anti-stress effect. Plus, it's been shown to actually support brain function and actually even support mood. And so there's, a number of research studies that I've kind of cherry-picked some of them just to kind of give you some of the most important highlights. Again, showing that people that are under chronic stress taking 300 milligrams twice a day for 2 months showed lower cortisol levels, better thyroid function, increased calmness. You can see here, this is a similar study showing the decrease in the percentage of change when you look at placebo and the improvement with the ashwagandha. So these are all different questionnaires that are being administered. And then finally, serum cortisol significantly went down after taking ashwagandha. They also found some of the other effects of withania is that there was less emotional eating, there was lower levels of inflammation, and there was, especially interesting for men, increase in testosterone. And there are certain extracts of ashwagandha that are being touted for testosterone boosting, like KSM 66, for example. So the effect of ashwagandha on the brain has been well known, and you can see here in this 2020 systematic review, which is always a nice thing to see, summarizing all the research that's been done to date, showed that it does have an improvement on cognitive function, executive function, attention, and reaction time. Okay, and so AOR's Gonda 600 is one of our most popular products. I have to say, a lot of people that have tried this, they've really appreciated the fact that you can get a beneficial effect with just taking 1 capsule a day. It's a very high dose. You're getting a really, really potent formulation. And a lot of times, and I find this is just my feedback, is that especially women that are in that middle age to that menopausal years, Gonda seems to be really, really helpful for them. And they're typically presenting with like, I'm stressed out, but I can't sleep. They might have some hormonal issues that are happening. They might have the effects of long-lasting stress through, childhood years, work now, getting back in the workforce, etc. So think about it for those particular women. And you can take it in the evening. Some people do find it a little bit sedating, and some people don't, so you can take it during the day. It's also, ashwagandha is present in the OrthoAdapt formula, which is one of AOR's flagship formulations, one of our best sellers, and it is there at a lower dose, and so you're still going to get the therapeutic effects with doses of 250 milligrams, but you're getting a really good dose with the Gonda 600. Okay, next up, Rhodiola Rosa. We've heard of this herb also, one of the most well-known adaptogens traditionally used in Russia, and they were studying it a lot for, their military. How do they, these aircraft controllers, pilots, people that have had to sustain their concentration for long periods of time, they were trying to study rhodiola for these particular people. And they found good effects, and that's where a lot of that research actually comes out of. So think of if ashwagandha is that kind of wired and tired, anxiety and fatigue type of herb, rhodiola is great for fatigue, but I think of it even more for physical and mental focus. So it's kind of like that sharpening herb. Also balances cortisol, and it's similar to ashwagandha, like many other adaptogens, it regulates blood sugar, which will reduce binge eating. So that is one of the research-based specific benefits. Specific on dopamine, norepinephrine, serotonin, and acetylcholine, so very wide range of effects. So it has multiple neurotransmitters. Most good herbal adaptogens have multiple neurotransmitters that they address, and that's going to give you a much more balanced effect. That's the difference between something like, an amphetamine substance, which is working on a very specific neural pathway, bumping up catecholamines. But when you do that, you have a negative downstream effect where you have one really, really high, but now you're going to have issues with some of your other neurotransmitters, and then obviously the coming down off using those amphetamines. With rhodiola and many other herbs, they have multiple effects on multiple neurotransmitters. It also has anti-inflammatory and antioxidant effects. That was one of the neat things after looking at the research again in a lot of detail that I found was that a lot of these botanical substances, they have these neuro antioxidant and anti-inflammatory effects, which is really nice to see. AOR's Rhodiola Rosa has a couple of formulations. It's in Ortho Adapt. It has a standalone, which is a high dose. That's 340 milligrams per capsule. Just from a clinical perspective, sometimes people find that when you use higher doses of rhodiola, so let's say 600 milligrams plus, you're going to get a little bit more of a kind of a calming effect, where low doses are stimulating. It's actually similar in the pharmacological world, where very low doses of amphetamines, like you find in Ritalin, for example, are actually going to be calming. So why are you using a stimulant like an amphetamine for ADHD, which people are overstimulated? It's because this kind of paradoxical effect of very low doses have calming effects, and higher doses obviously have suppressive effects. Very fast acting. There's research showing that even a single dose can work quite quickly in 5 to 6 hours, even maybe as little as 30 minutes. And so I primarily look at rhodiola for mental fatigue. So if people are saying, you know what, I just can't focus, my brain's off, I might have mood issues, might be having brain fog, rhodiola would be one that I'd be looking at. Panax Ginseng. I find ginseng gets, actually, believe it or not, one of the most studied herbs in the world, and probably because it's so popular and because it's available in a lot of formulations and products that are available, on online retailers and in pharmacies, it gets a bit of a bad rap. But ginseng has probably the most research out of any adaptogenic herb, definitely rivaling that of withania and ashwagandha. There is a lot of beneficial effects associated with ginseng. There's many types of ginseng. This one specifically that I'm looking at is Panax Ginseng, which is also known as Asian ginseng. There's also Panax Noto Ginseng, which is kind of traditionally considered American ginseng, which has a little bit of a different effect. Some studies show that it has more of a immune stimulating effect, less cognitive effect, but there's research that's showing benefits of multiple types. So if you're looking for the cognitive effect, I would probably start with the Panax ginseng, the Asian ginseng, and then look at other ones if other ones don't work, if the Panax doesn't work for you. Similar to rhodiola, again, increases the release of neurotransmitters in the brain, enhances the balance of your cortisol hormones, your corticosteroids, and the other dopamine, serotonin, and GABA. So again, a very balanced effect. Impact on cognition, similar to rhodiola, improved alertness, fatigue. It also helps support physical fatigue. A lot of times people have been taking this traditionally for athletes that are required to have kind of like a physical need, physical function, anyone that wants to improve their stamina. When I really dissected the literature, the takeaway point is that, number one, there was a quite fast effect, similar to rhodiola with taking ginseng. So you're going to have benefits that are going to happen right after starting to take it. And secondly, is that you're going to have this improvement in memory. So like, for example, some of the secondary effects. So like working memory, for example, or recollecting something. And this is a lot of how the research is being done, but not necessarily on, the immediate cognitive effects. Like, for example, like reaction time would be one of them. There are things that are more beneficial for reaction time. And so the research study found that it had very similar effects similar to Monofil or Concerta, which is a very commonly prescribed narcolepsy and ADHD medication. So the research actually is quite good on Panax Ginseng. AOR has a formula that combines rhodiola and Panax Ginseng. And so just from a practical perspective, this is a really, really, really good combination, especially if you're looking for, I need to stimulate brain function, I need to stimulate immune function, I need to stimulate physical stamina. Rhodiola, again, we talked about the brain. Panax has the brain, has the body effect as well. So I really like this formulation. It's a very cost-effective formulation for getting a lower dose of rhodiola, which is a little bit more stimulating, where the standalone rhodiola is higher dose, which actually might be a little bit more sedating. So maybe more applicable for people that are looking for, you know, getting up to 3 capsules a day, maybe getting closer to the 1,000 milligram mark to get some of that anti-anxiety, antidepressive effects. And obviously the caution with any sort of stimulants, and Panax Ginseng is traditionally considered a very warming, a very heating herb. It can be overstimulating, so I would start slow and go up from there. The standardization on these formulations are excellent. Look at the labels to find those standardizations, but each particular rhodiola and ginseng is standardized to the active components. Plus, you're getting a really good combination with both the rhodiola and the Panax. I mentioned this already, but I just wanted to point out that adaptogens, we usually think, oh, we got to take it for months to get the beneficial effects. Not the case. Adaptogens have been shown to be very effective really after, you know, just a couple days. So after 7 days, showing the effect of, you know, in this particular case, you know, the level of stress compared to placebo of rhodiola, of the active component in rhodiola, Schisandra, Eleutherococcus, ginseng, and bryonia, showing that, again, very, very potent effects. And rhodiola is having some of the most beneficial effects out of these this group of herbs. Okay, Bacopa. Bacopa is one of those herbs that probably doesn't get as much credit as it should compared to kind of the traditional adaptogens that I just mentioned. But the more I learn about Bacopa, the more and more I'm impressed. Bacopa is one that's a herb that's been used for a long, long time. It's called water hyssop in, you know, from a common name perspective. So you might know it better as that, but used extensively in Ayurvedic medicine, and it was used a lot for helping elderly with brain function, but as well as helping kids with mental function. So it was already traditionally, thousands of years ago, considered a herb that is very, very effective in promoting brain function, but B, for children as well. And there's research showing improvements in ADHD and cognitive function in kids. Its effect, I would probably consider Bacopa maybe more of a classic nootropic. So it does have the neuroadaptogenic properties, which often are overlooked, but people do focus on, you know, improving cerebral blood flow and improving working memory, for example. I'll have to show you in just a second, but I also really appreciate the effects of this herb on cortisol levels. We don't think of Bacopa as lowering cortisol, and when we know what cortisol does to the brain when it's elevated excessively, damaging the hippocampus, decreasing the size of the hippocampus, you can see that Bacopa is a really good neuroadaptogen. And similar to rhodiola and Panax, you're going to have these anti-inflammatory enzymes like SOD2 upregulated. Here's the research summary on Bacopa: 9 studies in adults, 5 in kids. Quite impressive, actually, showing beneficial effects in enhancing memory, visual processing, lowering anxiety. I think coming out of this whole pandemic period, we're already seeing anxiety, social adjustments are going to be massive. Think of the kids that haven't had exposure to their friends coming back, being used to just looking at screens, interacting with them. They might actually feel more comfortable with that now. They're going to have major issues with anxiety, and the research is just starting to be done very kind of in a rudimentary survey type of way, but we're really going to have major issues. And so this is a great place for me to plug a webinar that I'm doing coming up. I believe Dr. Nibber is going to be mentioning the exact time of that webinar. I believe it's on the 19th of May. It's at 12 noon. I encourage everybody to sign up. It is going to be all about thriving post-pandemic, and I'm going to be talking a lot about mood. And I think Bacopa is one of those herbs that is going to be perfectly positioned to address the people that are going to be suffering coming out of the pandemic. Lots of research studies coming out, as I mentioned, but I really like that those cortisol benefits. What I also like about Bacopa is that there's research showing it has good brain bioavailability. That's an important point I haven't raised yet. what we often forget is that we look at, oh, this substance like curcumin is an excellent anti-inflammatory, and it can be applicable to so many, dementia and neurological conditions. However, does it get into the brain? And the answer for curcumin is no, it doesn't, unless it's been combined with a fat or it's been specifically created to have high levels of free curcumin, which AORs, curcumins active and ultra do have. But most curcumin doesn't get into the brain. And so its impact is on the gut-brain axis, but not so much on the brain specifically. Bacopa, on the other hand, does have good brain bioavailability. So a really good dose of Bacopa, 300 milligrams per capsule, and that's the common dose that you're going to find in research studies. Taking that for 3 months. Some patients, even though it's very well tolerated, some patients will notice that they do have a little bit of a gastric discomfort. Try taking it with food. That will offset some of that. But hopefully you have this little section here really just affirmed that if you haven't tried Bacopa, definitely try it and start promoting it, because I think it is really underappreciated, underutilized, considering the research and the benefits of it. Ginkgo, we have to talk about Ginkgo. It is probably the most studied nootropic in the world in the natural health space. And for again, similar to Panax Ginseng, rightly so. There's a lot of beneficial effects when it comes to especially blood flow and Ginkgo biloba. I worked in the landscaping and the horticultural world to put myself through medical school and through university. And if you've ever noticed, Ginkgo trees, I'm here based in Toronto, Canada, they do grow in Canada, and they're these really, really beautiful trees, and they're one of these slow growing trees. And you can see here, did you know here, this little section, it's actually the first Ginkgo leaf was found 220 million years ago. So it was definitely, it's almost like a dinosaur tree. So every time I see it, I kind of think of that. And it is a very, very beautiful tree, but it's been used traditionally in many, many circles for stimulating brain function. But a note to say is it's not just about taking the leaves, mashing them up and using it. Those you can actually have a detrimental effect. And there can be a harmful toxic effect of using Ginkgo that way. So the extract makes a massive difference. And so the quality of extracts on Ginkgo is definitely one of the things I talk about all the time. The standardization, like with AOR's Ginkgo, is one of the most important things to consider. So check out the website, look at the standardization. It is one of the most adulterated plants, highly adulterated plants in the market because of how popular it is. It is one of the most popular plants in Europe, especially when it comes to cognitive function and cardiovascular function. You can see some of the beneficial effects that have been listed in the research, not just for brain blood flow, also cardiovascular blood flow, like erectile dysfunction, headaches, migraines, eye health, PMS symptoms, ringing the ears, lung function. This was a huge aha moment for me. Supporting blood flow. The lungs are so rich in blood flow. Where does blood flow happen? Right after the right after the heart. It goes right to the lungs. And that is where the perfusion of oxygenation occurs. Our neurons don't function if they don't get enough oxygen. We know that the brain, it consumes over 20% of all the body's oxygen needs, and it's a much smaller percentage in terms of weight. So you're going to really see the importance of oxygenating the brain, and the Ginkgo biloba does that. There's over 2,500 people studied. The quality of some of these trials haven't been great, and as is the case typically with a lot of these older studies, back in the 60s, 70s, and 80s. But overall, they do show some improvement in cognitive functioning, improvement in activities of daily living, some of those global assessments of cognitive function, and even neuropsychiatric symptoms, which I thought was pretty interesting. Again, thinking that in the context of poor blood flow happening in the brain. And then obviously in conditions like stroke, this would be very, very beneficial. Let's take a look here. Ginkgo biloba, especially helpful for people that want to be preventative. And so that's one of the takeaways of this slide, is that you're going to have improvements in healthy people as well. And this is the definition of a nootropic. especially in kind of the neurohacker perspective. They're looking for, okay, you know what, I'm a 30-some-year-old or a 40-some-year-old, dad or mom or executive, and we're trying to improve brain function. Ginkgo has research in healthy people showing improvement in function. Definitely, if there's a family history of any sort of dementia, whether it's vascular, whether it's Alzheimer's, Ginkgo would be something that would be top of my list because of its effect on blood flow. AOR's formulation is 100 milligrams per capsule. It's a 50-to-1 ratio, really, really quality standardization. Obviously with Ginkgo, one of the most studied herbs, so we know about some of the interactions. So blood thinners, antidepressants, and NSAIDs, anything that will improve or it will change blood flow, you're gonna potentially have a risk for increased bleeding, so be careful of that. And definitely talk to your naturopathic doctor or your pharmacist or your family doctor about starting Ginkgo. I mentioned that to any of your clients. Super Focus. So this is a formula that came out recently. Some of you may not have heard about it before. It came out, I believe, in the beginning of 2020. And it's basically everything that I just talked about distilled down into one formulation. So I actually think this is probably AOR's best acute nootropic formula that we have available. So it is all the activated Bs, so all the things that you're going to get in your ABC. You're going to have a number of adaptogens. I'm going to show that to you in a second, plus caffeine, plus theanine. So you're going to kind of have all that focus, all that energy without that kind of super buzzed stimulant feeling because of the combination with theanine, the B vitamins, and the adaptogens. So you can see here the breakdown, some of the ingredients: 100 milligrams of theanine, which is a very good dose. Rhodiola, bacopa, full dose of bacopa, that's impressive. 60 milligrams of ginseng, caffeine, 100 milligrams, which is roughly, it is coming from green tea, but that's roughly the 1 cup of coffee. But because you're getting theanine, someone like myself, I am sensitive to caffeine, that additional theanine is going to offset the kind of jittery feeling that people might get from caffeine. Plus, you're going to get all your B vitamins, and they're, notice, in the active form. You're going to have the hydroxyl, methyl, the pyridoxine 5-phosphate. Don't discount the importance of B6, especially in the active form. I just glossed over that in the neurotransmitter section. But if you don't have B6, you cannot make any of your neurotransmitters. So it's an incredibly important neurotransmitter cofactor. So B3 is important, B6 is important, especially, and then for acetylcholine, B1, B2, etc. And you're also going to get a little bit of choline, as well as folic acid and inositol. And inositol is a really great ingredient. AOR has capsules, and then it has powder, which is going to get you into the gram doses. It is kind of like a receptor sensitizer. So it's part of the B vitamin family. I believe it's called B8, but it's never called by that, but that's the official classification. But it helps sensitize the receptors to neurotransmitters. And so people will notice that they get a calming effect of inositol, which is why that is in our B complex as well as in our super focus. So you can see a really comprehensive combination. There is also something to be said for the combination and the synergy that occurs with some of these ingredients. So you can see in that did you know info box, again, beneficial green tea effects on cognition observed under the influence of both caffeine and L-theanine have found to have a more beneficial effect, where if you introduce them separately, you're going to get a much lesser effect. So there's a synergy, and especially as it normally contains and found in green tea. Green tea has a little bit of caffeine in it, maybe 30 to 50 milligrams, a much lower dose than regular tea and coffee. It does have theanine in it. It does have a lot of those catechin polyphenols. That is one of the main reasons that AOR's active green tea is a full spectrum green tea extract, because it respects the research studies on the full spectrum of tea consumption. So just doing EGCG, in my opinion, is really just pulling out one substance and missing all the synergistic beneficial effects. Most of the research on green tea is done on actually drinking cups of green tea, not on EGCG. So that is one of the reasons why AOR's active green tea is so beneficial, and which is one of the reasons why I really like this super focus formula, because it does respect the physiology and the kind of the phytochemistry found in green tea. So there's lots of applications. You can definitely see the, anybody supporting their mental focus, anybody that wants to maybe replace their caffeine, maybe wean off their, their addiction or their reliance on caffeine. Maybe they want to decrease their amount. They want to totally get rid of it. You can increase the dose, and definitely as athletes, finding that right dose that supports their athletic performance or cognitive function is recommended. And there's, again, this is more for reference. I'm not going to talk about this in detail, but there are other ingredients that have been studied that are in the AOR line that has support brain function, but as well as the physical performance. So remember, mental performance in terms of being an athlete is a very important thing to consider, especially when it comes to fatigue, when it comes to the perception of fatigue and stamina. So all these other ingredients are going to be helpful for supporting sport performance. And we'll look at these in a future webinar. Just a couple notes on caffeine as a nootropic. It has a unique mechanism of action, and what it does is that it antagonizes adenosine receptors. And anybody that has looked into sleep before will know that the reason people get tired is that there's a steady buildup of this thing called adenosine. And that's one of the reasons why, people will, no matter what, if they try to push through, will eventually get tired, because it's not so much about GABA, which is a calming neurotransmitter, or serotonin, which they all do help with sleep. Adenosine levels, as they go up, the brain just cannot stay awake. And then as you go to sleep, you wash away the adenosine, and then that process starts all over again. And caffeine kind of offsets that. And so definitely the research is clear, is that it will improve alertness, attention, especially when you're fatigued. So for me, I don't want to use caffeine all the time, because I want to reserve it for times when I am fatigued, because there's a bit of habituation that happens. There's also a bit of withdrawal that occurs as the brain is used to having caffeine, and a lot of the vascular effects of blood flow and the effect of caffeine on that, especially the brain, is responsible for things like headaches. So for me, I'm looking at caffeine as I want to use it for when I need it the most. If people are using caffeine from an abusive perspective in high amounts over a long period of time, you're not going to get the same effects of that caffeine. And so I think that's where a formula like Super Focus can be really, really valuable, and it can still be used in combination with caffeine, or maybe using Super Focus later in the day to kind of augment that kind of mid-afternoon crash as you kind of regulate out your hormones, because you're still going to get the beneficial effects of Panax and Rhodiola and Bacopa at regulating cortisol. So overall, caffeine is good at supporting your alertness and attention, but it is not a nootropic. And this is something students and people that are using caffeine as an upper should really take to heart. It may actually, even though you're up, it may actually hinder activities that really rely on working memory. So think of that for students. So using caffeine to kind of power through may actually work against brain function and against memory storage, because again, it's usually pushing people to not get the proper rest that they need. So I think it should be used wisely, but maybe not in such an abusive way. Theanine is one of AOR's go-to amino acids in the form of Zen-theanine. It is found obviously in Super Focus, but a higher dose is going to be found in your Zen-theanine standalone. So 225 milligrams per capsule. Again, normally about 25 milligrams per cup in green tea. So you're going to get a much higher dose of the amino acid theanine. One of my favorite amino acids, because it is truly a nootropic. It's been studied to support learning and memory, but it does have this calming effect. So it's great for people that want to keep themselves focused and alert, but without kind of getting that overstimulation. It also does improve sleep quality, does combat the effect of stress. That's a well-published, well-researched indication. It does have this immune beneficial effects too, because it does support the production of glutathione. This is a very little known effect of L-theanine. So L-theanine does much more than just calming you. It also helps, like as I mentioned, memory, immune function, lowers blood pressure, offsets the effect of caffeine, and it's safe for people of almost all ages. Very safe in terms of medications as well. Very few interactions because it's an amino acid, very well tolerated, and works very quickly. So I would say probably anybody that's struggling with any sort of anxiety and stress, it'd be the first thing that I would try because it's the most gentle, and I would play with the dose to see if I would find, 1, 2, 3 capsules to find that beneficial effect. If you want a quicker action, you can actually open up the capsule and pour the amino acid right on your tongue to get a quicker effect. For those of you that have access to the AOR's professional line, there's an exclusive formula there called Pro De-Stress, one of the most successful products in the Pro series. It's quite simple: GABA, theanine, and holy basil. Love holy basil. Not going to talk about it now, but holy basil is a nootropic. There is cognitive beneficial effects of holy basil in its own right. AOR has it as a standalone. And the combination of theanine, GABA, and holy basil is excellent for acute anxiety, but also for people that have blood sugar issues, so that kind of hangry impact. Holy basil has that blood sugar balancing effect, plus all that anti-inflammatory adaptogenic effect. So a really, really well thought out and effective short-term, acute, and long-term formula. Okay, so that is the adaptogens, some of the nutrients. I think we've had a really good idea about that. I'm just going to finish up talking about some phospholipids, some good fats, because you can't talk about the brain function without talking about good fats. Phosphatidylserine is one of my favorite phospholipids. A lot of good research on phosphatidylserine for cognitive function. This has been done, decades ago, but it does decrease age-associated memory impairment, not for dementia. I'll say right here as a point of note is that most substances, especially both drug and natural substances, once a person has full-on dementia, they don't really work. The neurodegeneration is far too gone. But what you're noticing here, like with Ginkgo, phosphatidylserine does help decrease that kind of gray period between full-on diagnosis of dementia and normal functioning, that kind of mild cognitive impairment or age-associated memory impairment. That's where I would be looking using phosphatidylserine. One of its unique effects, which is why it's one of my favorites, is that it helps decrease cortisol. It does this in a really unique way. What it does is it resensitizes the hypothalamus. What does that mean? Well, if cortisol levels are high, the brain is always sampling levels of hormones in the body, and it downregulates the production of cortisol, basically the regulatory mechanism in the master gland in the brain called the hypothalamus. And eventually the hypothalamus receptors under high levels of cortisol, it basically gets desensitized. So that control is broken. And so now you have just tons of high levels of cortisol, and you can't shut it off. Phosphatidylserine helps resensitize those cells in the hypothalamus. So it's really, really excellent for that. And you have to use, quite a good dosage of that, maybe 400, 500, 600 milligrams. AOR's phosphatidylserine is from cold pressed sunflower. It is a patent extract called Sun PS. Very safe, very little drug interactions. And just from a mechanistic perspective, for those of you geeks out there like me, this is phosphatidylserine right here. These yellow guys, they're embedded on the inside, the intracellular space, and they help with the not only the cortisol, but also the transmission of messages through the cellular membrane. 100 milligrams per capsule, so you don't be afraid to dose up on phosphatidylserine, but helpful for people that are suffering from high cortisol late at night. And so taking it late before bed is probably the optimal time to use phosphatidylserine. Choline, so again, phosphatidylserine is in the family of phospholipids. Choline has a huge impact on so many different things, from cellular membranes, brain development, pregnancy, muscle function, heart health. So I wanted to give everybody just a quick little a rundown on phosphatidylcholine especially, but also choline in general, because it's one of these overlooked deficiencies. And I included, choline deficiency as something that is overlooked because it is something that's present in the literature and often overlooked in liver issues, especially people that are struggling with hormone metabolism and detoxification, think of estrogen levels. Choline is found in AOR's EstroAdapt, which is a hormone balancing formulation. It is also helpful for fatty liver because it exchanges damaged phospholipids for healthy phospholipids. And it does decrease homocysteine, which is an independent risk factor for cognitive decline, as well as cardiac events like stroke and MIs. So homocysteine is something we want to decrease. So choline does play a role in detoxifying that. And then finally, as I mentioned, any sort of brain, we think of, nootropics as always something you can take as an adult, but what about when you're in the womb and you're in utero? That's where brain function starts. So if you are, like, for example, in the study where I'm looking at the pregnant women in California, 20%, 25% of the population consumed inadequate levels to prevent birth defects in their fetuses, meaning 1/4, 25% of pregnant women are not getting enough choline for their fetus brain production, just to get the bare minimum, just for birth defects, not for optimal brain function. So I wanted to make the point of, we have to also think about in utero nutrition. And so a lot of the foundational things that I talked about, vitamin E, choline, vitamin C, very important for brain function. Zinc is another one, iron levels for the fetal brain production. I want to put a quick plug in for the My Blueprint DNA test that AOR launched. One of the sections is on choline metabolism. So if you haven't checked out the My Blueprint, please do. There's a dedicated website to it, myblueprint.ca, talking all about all the different nutrients, and choline is one of them, that you can have a mutation in the way that you metabolize choline. And if you have this mutation, you're going to have issues absorbing it, and you may have issues absorbing fat. So you may actually need to support your bile, you may need to support your lipase and your pancreatic enzyme production, which breaks down and helps absorb fat. So many things, like for example, statins, the #1 most prescribed medications in the world, they actually decrease fat absorption. Fat soluble vitamins are a deficiency that occurs after a lot of these cholesterol medications, including statins. So we have to consider them as a deficiency, like the study in California with a fetuses found. You can see, look at all the benefits of choline, and this is one of the active components of choline, PEMT, and phosphatidylcholine from cell signaling, liver disease, atherosclerosis, bile production, homocysteine. It's much wider effect than we might think. So AOR does have a standalone cytocholine. Cytocholine is a substance that is a source of phosphatidylcholine, but it's unique because it's a precursor to other phospholipids, including phosphatidylserine. It has a wide range of studies showing that it improves neurotransmitter balance, so not just giving the base cellular membrane function, but also neurotransmitters like serotonin and acetylcholine. It's been studied in glaucoma with eye health, because again, the optic nerve is very rich in fat and myelination. The eye itself also is very rich in nerves and receptors, the rods and the cones, if you remember back to physiology. So acetylcholine is very important for that. Phosphatidylcholine, serine, and even other phosphatidylipids. The specific form that AOR uses actually changed in the last couple of years. So this is important to understand. This is a source from Spain. Over 95 human clinical trials on Zeronous, which is the patented form of acetylcholine. So I prefer to use this form of phosphatidylcholine, especially when it comes to brain function, because it has the research on being a nootropic, supporting brain function, supporting neurotransmitter balance without upsetting the normal balance of phospholipids in the brain and in the body. Check out the AOR website. They do have a specific page just dedicated to detailing the benefits of Zeronous. I found this is a neat kind of summary chart, just looking at what's the difference between phosphatidylserine, phosphatidylcholine, and citicoline, and then acetyl L-carnitine. They often get kind of mixed together. Acetyl L-carnitine is not a phospholipid. It is a mitochondrial booster. It shuttles fats into the cell. And so this is important for supporting mitochondria, but we're not going to cover it in the sense of nootropics. But I did want to mention that it does have some nootropic effects on, again, stimulating mitochondrial function. It does support phospholipid synthesis. Cytocholine does that as well. But the advantage of cytocholine, again, over just taking phosphatidylserine, is that you're going to have the effect of having a neuroprotective agent, and you're going to support neurotransmitter function. Acetyl L-carnitine does not do that. All three of these substances do improve memory, and they do have a cognitive effect, which is why they're all considered nootropics. And so finally, the summary formulation of some of the adaptogens we talked about, and then like Bacopa, Panax, and then finally Cytocholine, is going to be a formulation called OrthoMind. This is probably, if I said on record that Superfocus is kind of AOR's acute nootropic, I would probably say that AOR's OrthoMind is the long-standing, long-term nootropic formula, probably the gold standard nootropic formula. And I really like it because it addresses all aspects of nootropics, both from an adaptogenic perspective, both from a mitochondrial perspective, as I just mentioned with acetyl L-carnitine, from a phospholipid perspective, from an antioxidant perspective, which is lipoic acid, which we haven't even got into. But the reason, again, being there is that it protects neurological tissue from damage. And then finally, arginine pyroglutamate, which I wanted to spend a little bit of time just talking about. This is one that often gets overlooked in this formula, but it is an amino acid. You probably kind of got that from the glutamic acid component, but it is an analog or very similar, I would say maybe not analog, but even a precursor to those old orphan nootropic drugs, such as piracetam and the other classes in the cetam category. And these substances have been shown back in the 1970s that they improve learning, memory consolidation, retrieval in normal healthy people. So you can find these touted all over the internet, and a lot of these kind of neurohacker and these nootropic websites showing that, a various combination or stacks or combinations of these particular substances showing beneficial effects. In Canada, arginine pyroglutamate is available. That's why it is licensed in OrthoMind, and it's the precursor to these cetam class of orphan medications or nootropic drugs. We don't really know exactly how it works. There's a number of mechanisms of action, but a lot of people state they kind of feel like their brain's more woken up. Interestingly, there are some studies, some evidence in animals showing that it improves sexual function. That may be to do with the fact that it's arginine L-pyroglutamate. It could be to the fact that a lot of sexual function in terms of libido also comes from neurotransmitters. So it's not just about testosterone or other hormones. So this is a substance that has a lot of safety behind it because of its effect, long-term use, but it is a very unique way of tackling the nootropic, which has not yet been touched on by any of the herbs that we looked at. So again, OrthoMind, really a very synergistic nootropic. One thing I do want to mention is that with a dose of OrthoMind, it is 6 a day. And so you do have to kind of work your way up to get to the right dose for you. And so some people always say, well, I've tried 2, it doesn't work. And they're intimidated by the 6 capsules a day. I wouldn't go to the 6 capsules right away. I would look at, starting with 2 a day, seeing how the brain functioned. And even it does say this on the label, is that you have to kind of increase it until you notice that brain beneficial effect, that nootropic effect. Like, for example, you're more focused at work, your mind's not wandering, your concentration's better, your energy's better. These are all kind of those key telltale signs that you're at the right dose of OrthoMind, and that's where you stay. There are many other nootropics. Haven't had time, unfortunately, to go over all of them. I touched on acetyl L-carnitine, which is the first one here, just a little bit. It is in the OrthoMind. Tyrosine's standalone by itself. Huperzine A is not available in Canada. We used to have it in a formula. Vinpocetine, great ingredient. It supports blood flow, very similar to Ginkgo. May actually have some more beneficial effects than Ginkgo, so I'm a huge fan of Vimpo. and not as much research on Cytocholine asiatica. So that's everything that I want to talk about today. I know that was a bit of a whirlwind, but I really wanted to give us a full perspective of nootropics, really making sure we understand the foundations of nootropics, as well as some of the kind of hormonal gut-brain axis, and then finally get into some of the classic nootropics. So if there are any questions, I'm going to kind of go through them. I'll let you take it away, Dr. Neera.
Yeah, thank you. Have heard you speak so many times, and I'm always learning something, so I really appreciate that. We have had some really great questions. So, a couple around the risks for supplementation of ashwagandha in terms of testosterone in females. Can you speak to that at all?
Yeah, really good question. I think first thing to remember is that there are cautions around ashwagandha, and the typical caution that's right away on the top of the list is too much of a good thing. So that's why it'll say be cautious with any sort of antidepressant medications, because ashwagandha has its own antidepressant effects. I think what this question is driving at is, conditions like polycystic ovarian syndrome or excess androgens that are seen in PCOS. Could ashwagandha exacerbate that? In theory, it does raise DHEA, so it could do that. But the more that we understand adaptogens, as I've tried to highlight in my presentation, the more that we have to appreciate the fact that they do things in such a delicate balance. So if a person is elevated in DHEA, it may actually have a more balancing effect. So it could be if they're deficient to start with. So I would say we don't 100% know. However, I probably would look at, still be pretty comfortable looking at other ashwagandha and adaptogens in general. Maybe if we're really being concerned about that, I would maybe go with something like rhodiola, or I would go with holy basil, because it has a blood sugar balancing effect, which is often seen hand in hand with excess androgens in PCOS.
Awesome. Yeah. Now, actually, on the topic of rhodiola, kind of switching gears, but still with the adaptogens, there is a duality to its effect. And you had mentioned, at higher doses, up to 1200 to 100 milligrams a day, there's more kind of the anti-anxiety sedative effect, and then 100 to 600 is a little bit more of the stimulatory. Do you find that, at the stimulating dose, it's comparable to ashwagandha, stronger? Or how would you compare that to ashwagandhas?
Yeah, good question. I try to address this a little bit in the presentation, but I'll repeat it here again with a little bit more context. I would say overall, if I'm looking at the research, definitely rhodiola is more stimulating than ashwagandha. So I will say a resounding yes. Everybody's a little bit different. So when we look at some of the doses, and I mentioned some of the low doses are a little bit more stimulating and the high doses are a bit more sedating, I'm usually talking about the doses well above what was used kind of in the traditional adaptogenic rhodiola studies. So for example, AOR's rhodiola is 340 milligrams. I'd probably still consider that a medium to low dose. When you look at the research, maybe over a gram, so over 1,000 milligrams, you might get some of the sedating effects. I still think you're going to get a beneficial effect on mood and depression and anxiety with rhodiola at a lower dose, because again, as an adaptogenic effect, remember, rhodiola influences all the neurotransmitters, so you're going to have a full spectrum of balancing that's occurring. So definitely more stimulating, but it still can be quite balancing. And there's also quite a bit of variation between the different herbs, as you mentioned, is that you're going to get one herb going to be great for some people, like the gonda by itself, and then some people don't do well by doing gonda, but they shouldn't give up on adaptogens totally. They should maybe look at rhodiola by itself, or maybe the rhodiola plus Panax Ginseng.
Yeah, it's adaptogens by trial and error, I guess. And actually, on that note, I know you mentioned a lot of the adaptogens for cortisol reduction, but I think someone just needed a repeat. Do you have a favorite one for cortisol reduction for adaptogens?
Yes, I would probably say the one I use the most is a combination of rhodiola and ashwagandha. That's probably the most researched, I would say. And probably the one I see most in my clinical practice. There is a formula that is coming out. It is coming out shortly. It's called Cortisol Calm. It's a formula that AOR is launching, both in the Pro Series as well as in the retail line. And that does, give you ashwagandha combined with bacopa. So I think that, the idea behind a formula like that is that it's a neuroadaptogen, and that's something that hasn't really been well addressed in the market. So I'm really excited about that formula, really to see it with my patients. But I would still say ashwagandha is top of my list. But I have to say, I would probably easily include bacopa in there now that I've seen the research. And the trouble is that just from a practical perspective, usually people don't reach for bacopa when it comes to kind of calming themselves from a cortisol perspective. I also should probably mention magnolia is one that's used often, a bit more expensive. Philodendron's another herb that has been shown to reduce cortisol, but my favorite is ashwagandha, probably followed by rhodiola.
Mm-hmm. And now you mentioned with ADHD medications, these are often overprescribed. For children who are suffering kind of with learning and cognition, do you have memory? Do you adapt things for teenagers and kind of younger populations? How do you kind of approach that?
Yeah, definitely. You have to adapt things. I mean, I think that, like the disclaimer at the beginning of the presentation said, obviously you can't take anything that you learn through this educational webinar as a diagnosis. And I think anybody that's, if they're a clinician, great that they can use their clinical judgment. But if you're in the kind of a scope of a practice, you have to, or sorry, a store, I should say, you have to be more cautious. And so definitely start with the ones that have the research on it. L-theanine, bacopa are the top of my list. Then look at all the foundational things that I mentioned. B's, magnesium is another one that I would probably consider, first line. Zinc is another one that is often majorly deficient in people, but from an acute effect, I would say L-theanine is my absolute favorite when it comes to looking and getting kids relief. And I've seen that in my patients over and over again. And so obviously over and above that, that's where you have to kind of work with a practitioner that has experience in peds.
Yeah, I agree. And I think probably the last question we'll have time for is, and this is quite specific, but it's just nootropics for particular to vertigo. Have you seen any research on that? Is that an area that lots of people are studying?
Yeah, I think vertigo is a pretty resistant condition to treat, definitely from a supplemental perspective. But I have seen quite a bit of it, and I think the combination of both hands-on therapy, so manual therapy, as well as addressing the vestibular, so balance type of thing, so the ocular, so a neurooptometrist would be absolutely essential to deal with that, in my opinion, and as well as people that are able to manipulate, like with the Epley's maneuver, able to manipulate the crystal lifts that are in the ear, which is basically that little organ that is responsible for the balance that we kind of interpret where we are in space. So that's like the foundations. And then after that, there is some research on bacopa with convulsions. I'd probably go with like a substance like bacopa that's very brain specific. I'd probably go with something like Ginkgo because of its blood flow, and then something like phosphatidylcholine and phosphatidylserine would be a good one as well, just to kind of fuel the brain, making sure that it has enough, and supporting general neurotransmitters. That's probably where I'd start from like a nutraceutical perspective when it comes to vertigo. But you ultimately have to look at what triggered the vertigo. Was it a viral infection? Well, we got to treat that. Was it a brain injury? Well, we have to address the inflammation around that. And so you have to look at all those things. So it's a bit more of a complicated and a bit more detailed answer that would be on a case by case basis.
Mm-hmm. And I love that you talk about, collaborating with other appropriate healthcare practitioners. I think we always jump to, what is a supplement that will do this? But as practitioners, we're always looking at the holistic strategy.
For sure.
So it looks like that is enough for time for questions.
Yes.
I really want to thank you again. That was very detailed and just so rich. We're getting so much positive feedback. So if anyone does have additional questions after this, you can certainly email them to marketing@aor.ca. That's marketing@aor.ca. So we have a few very exciting webinars coming up. So the soonest one is on Thursday, May 14th at 12 p.m. Eastern Standard Time, and it will be with Dr. Sarah Zadek, who's a naturopathic doctor, presenting on addressing hypothyroidism and Hashimoto's thyroiditis. And a very topical presentation that Dr. Erkel already mentioned is Thriving Post-Pandemic, Implications for Your Mood, Microbiome, and Cardiovascular Support, which I know many people are probably looking for that support. That's going to be presented by Dr. Erkel on Tuesday, May 19th. That's next Tuesday at 12 p.m. Eastern Standard Time. If you're not yet registered, no problem. You can certainly sign up at aor.ca/webinars/B, the letter B, the number 2, and the letter B. So B2B. Thank you, everyone, and have a wonderful afternoon. Take care.